still taking some Imodium here?
As needed.
How often do you have to use that?
Very seldom.
It was about 2 o'clock that afternoon. A surgeon from out of town came, thinking they were going to remove my appendix, and got in there and found out I had stage 3 colon cancer. The nurse come in and she's like, "Mary, you're so young." And Mom goes, "Well, I was 35 when I had mine." And we all just kind of looked at her like, "What?"
And then I thought of my mom's incident. It's like, I'll just man up and just go get it done. It can't be that bad.
7 years ago, I met Ryan. He was having some symptoms in his GI tract, some abdominal pain, and he was having blood in his stools. He had had a colonoscopy done before he saw me, which had already demonstrated that he had lots and lots of polyps.
My local doctor did it. He's like, you're out of my league. I've never been out here to the hospital. I'm living in central Iowa, and so that's the journey began.
When we met, he shared with me his history with his mother having had colon cancer at a young age, under 50, an aunt that had it, and as well as his grandmother. So at that point, it was fairly clear that he likely was part of a family that had a genetic predisposition to colon cancer. With that, when you see this particular syndrome, these are patients you want to screen at a much younger age, and it's usually predicated on the age of the youngest diagnosed person in the family.
I'm coming to call myself the guinea pig of the family. Everything that can go bad with this genetic, I find it out first.
We ultimately went in and did his colon resection, did a total colectomy, proctectomy, and we did indeed find an early stage colon cancer in one of these polyps, which was a T1 colon cancer, or stage 1. What this triggered was then a reflex to check his family members, and he had 3 other siblings, and there's about a 50-50 shot, but all 3 of his siblings indeed ended up being positive for the gene test. This is the desmoid tumor that Ryan presented with, so he was having nausea and vomiting and pretty severe abdominal pain.
That was probably the worst feeling I've ever had.
He received about 6 months of chemotherapy. I would say within the first or 2 treatment sessions, his symptoms began to improve, and he got better. Once you know that this exists in a family, is to do preventative action in the family. And we know that there's a 90 to 99% chance that patients with FAP, if untreated, will have a cancer event at some point in their life.
Get it out there in the open, and it's not going to make it go away by ignoring it. It's not going to go away.
Through the whole thing is growing together as a tighter family. Throughout all this, it just links you, brings you in tighter, so you kind of got a real good bond. The earlier you catch it, the better off you're going to be.